Hey everyone, just a quick heads up. Since I record this video out in nature, you'll hear the buzzing sound of the insect cicadas. They come every 17 years in big numbers and they create this chorus sound that you'll hear throughout this video. Think of them as a natural soundscape, okay? Now let's dive into the video.
I'm Dr. Sri. I'm a board-certified family medicine and sports medicine doctor with a background in exercise physiology and integrative medicine. So I just had a white jasmine rice with Indian curry. And if you're like millions of people with pre-diabetes or type 2 diabetes, that meal might just come with a nagging worry. Basically, a massive blood sugar spike. My blood sugar is shoot up because research shows that when that happens, it comes with a lot of problems. These problems include damage to the inner lining of our blood vessels, more inflammation in our body, and a higher chance of getting diseases like type 2 diabetes if you have pre-diabetes, fatty liver disease, heart disease, arthritis, among others. So the burning question is, how do we stop that spike? Can exercise actually help? And if so, when is the magic window? Right after the meal? Or should we wait? How long do we need to move? And what kind of exercise gives us the biggest bang for a buck? So stick around because in this video, I'm going to provide evidence-based answers for all these questions. So without further ado, let's get started. So first, let's break down what happens after I ate that jasmine rice. So jasmine rice is high on the glycemic index. So basically, glycemic index tells us how fast our carbohydrates turn into sugar into our bloodstream. Rice is starch, which breaks down into glucose, and that glucose floods our bloodstream. Our pancreas then releases insulin to shuttle that sugar into our muscles and liver. But any extra glucose is going to get stored as fat. But let us say that you've got insulin resistance. So think about this way. So let us say the insulin is the key to the cells, and basically the insulin is going to unlock the cells and thereby the glucose can enter into the cells. But let us say the key is there, but the key is not functioning properly. Thereby, the blood sugar starts to accumulate in the bloodstream and thereby causing the high blood sugar. Some patients with type 2 diabetes can also have insulin deficiency. So when you have insulin deficiency, again, it's going to be only partial. If somebody has a complete insulin deficiency, then we call this as a type 1 diabetes. So let's say some people can have a partial insulin deficiency, and maybe because of the pancreatic beta cells have been overburdened by the insulin resistance and thereby the insulin is not being produced a little bit. In that case, again, the blood sugar is going to accumulate in the bloodstream. And in both cases, both insulin resistance and even with a partial insulin deficiency, the outcome is basically high blood sugar. So let us understand why is exercise our secret weapon. So we just talked about that the body needs insulin to shuttle the glucose into the cells. But during exercise, one does not need insulin to shuttle the glucose. So basically, the glucose lowering effect during exercise is independent of insulin action. So based on how our body reacts during exercise, we know that during light intensity activities like casual walking, our bodies mainly use fat for energy and not so much glucose. But as we increase the intensity to moderate levels, such as brisk walking or jogging, the fuel source shifts to an even mix of fat and glucose. So pushing further to vigorous activities like running, our body starts to consume even more glucose from blood and other glucose stores such as the muscle glycogen and the liver glycogen. So based on what we know through our understanding of the exercise physiology, one must consider doing more of a moderate or vigorous intense exercise. For example, I'm doing a casual walking right now. Maybe I should start to maybe like jog or run in order to have a huge benefit when it comes to blunting the glucose spike. But you know what? I'm not comfortable doing a moderate or vigorous intense exercise because I feel full and I don't want to do such an intense level of exercise right after eating. So let's delve into the research to see if this is true and if exercise impacts the body the same way after eating. So the good news is that multiple studies have shown consistently that exercising after a meal can help to blunt the glucose spike. In fact, one study showed that exercising of any intensity can still have a huge benefit when it comes to blunting the glucose spike. So most studies indicate that exercising within 30 minutes after a meal is beneficial. However, some research also suggests that exercising up to 60 minutes after eating can still be effective. So let us say if you're wearing a continuous glucose monitor, then it's advisable to start exercising 10 to 20 minutes before the glucose spike starts happening. So in healthy individuals, studies have shown that the glucose spike might happen around 15 minutes after the meal, But in patients with type 2 diabetes or pre-diabetes, sometimes the spike can take up to 30 to 60 minutes after the meal. So to observe the post-meal spike, checking around 30 minutes and then again at 60 minutes post-meal can help determine the timing of your body's glucose spike. So however, I tell the patients that let's say if it seems to be too complicated, in that case, don't worry about it. But let us say if you're just going to eat the same type of food every day, then you can probably do one-time check just to make sure, just to get a general sense of when your blood sugar spike is happening. So this way you can plan your exercise around like 10 to 20 minutes before the glucose spike happens. But let us say if you don't want to do this complicated testing stuff, then in that case, just start exercising around 20 to 30 minutes after your meal. And I would highly recommend to make sure that you start exercising at least 60 minutes before your meal. Okay? It is important to remember that although exercising before a glucose spike can be more effective in blunting the spike, exercising even after 60 minutes following the glucose spike is still beneficial for reducing overall glucose levels. When comparing exercise timing, yes, exercising less than 60 minutes after a meal is good. But you'll also reap benefits from exercising after 60 minutes after you finish eating. So don't let the specifics of timing deter you from engaging in any physical activity. Remember, although in this video we're talking about exercise post-meal, remember exercise is at any time is beneficial. So let us say, for example, you have to skip exercise post-meal. Don't worry about it. Make sure that you exercise during the day at some point. That will help improve your sensitivity and thereby it can decrease the average blood glucose throughout the day. So now the next question is that how long should you exercise? For example, it's been almost 20 minutes now since I started walking. So studies actually show that even 10 to 15 minutes of light intensity or moderate intensity exercise is going to be beneficial. But the substantial benefit is going to be somewhere between 30 to 60 minutes of exercise after you finish your meal. For example, after finishing a meal, one could go for a 30-minute walk to achieve optimal glucose management and overall health benefits. Light to moderate intense exercise during this period helps improve insulin sensitivity and promotes glucose utilization by the muscles. If 30 to 60 minutes feels overwhelming, starting with shorter sessions and gradually building up can still yield positive results. So my biggest top practical tip is, in addition to your regular exercise, make sure that you engage in a post-meal walk at least one time during the day. And make sure that you plan that post-meal walk after your biggest meal of the day. For me, the biggest meal of the day is during dinner. I don't want to keep the biggest meal of the day during dinner because we know that the insulin sensitivity is not at its top peak during evening time. But at this time, that's what works for me. But if you can make your biggest meal of the day during lunch, then go for a post-meal walk. I usually like to engage in at least like 20 to 30 minutes of light intensity walking after I finish a biggest meal of the day. So research indicates that exercising after meals, even at the light intensity, results in our body using more glucose for energy compared to exercising in a fasted state. This is particularly significant for those with pre-diabetes and type 2 diabetes. In pre-diabetes and type 2 diabetes, the body often has difficulty with insulin sensitivity or suffers from basically insulin resistance, which means that glucose is not effectively taken up by the cells for energy. Post-meal exercise can aid in the absorption of glucose into cells. But let us say if you're stuck in the clinic just like me, for example, sometimes we'll have these meetings where we get offered lunch from a good restaurant like Panera or McAllister's. And even though I want to avoid, sometimes I engage in eating a little bit of starchy food like bread, and then I'm worried about the glucose spike. So I'll share a clinic hack that I usually do in order to blunt the glucose spike. I may not have time to go for a long walk, so I usually do mini bursts of resistance exercise. For example, I'll do one set of 20 to 30 repetitions of squats or lunges, 20 to 30 repetitions of push-ups, 20 to 30 repetitions of biceps curls using resistance band, and I repeat this every hour for 3 to 4 hours. Or if the office has stairs, a quick 5-minute stair climb every hour or so can also do wonders. So when it comes to the intensity of exercise, I usually feel light intensity exercise like casual walking, just the pace I'm doing right now is probably the best. But let us say if your job allows, for example, like after a meal, and if I'm in a professional setting, I don't want to go for a moderate intensity walk, have a lot of sweating, and then go see my patients. So light intensity walk is perfect for me. But let us say if your professional environment allows to do a moderate or a vigorous intense exercise, and then you can probably go for a shower before you go to work, perfect. Just go for it. As I said, one study showed that it didn't matter what type of intensity, both the light, moderate moderate, and vigorous, all three were pretty helpful in blunting the glucose spike. So regarding high-intensity interval training, it is indeed effective and offers significant health benefits including improved insulin sensitivity and rapid glucose consumption. However, due to the vigorous nature of the high-intensity interval training, it is generally not recommended immediately after meals unless you are very comfortable. High-intensity workouts can sometimes be very uncomfortable or impractical immediately following a heavy meal due to the physical demands and the potential for gastrointestinal discomfort. So what is my strategy to decrease blood sugar spikes? First of all, I should not be having this white jasmine rice all the time. So usually I would prefer a low glycemic index starchy carbohydrates like steel cut oats or quinoa or bulgur wheat. And in spite of having a low to medium glycemic index carbohydrates, and I've covered about glycemic index in a separate video, and I'll link the video in the description box below. But once I consume a low to medium glycemic index carbohydrate, I still will go for a 20 to 30 minute stroll after heaviest meal of the day. However, on occasions, I would indulge in a high glycemic index carbohydrate. For example, I just had white jasmine rice with some curry, and I also had some mango sticky rice as well. So high glycemic index carbohydrates. During this time, I change my approach a little bit. In these situations, I incorporate exercise prior to the meal, usually something moderate to vigorous. If it is high-intense interval training, I like to schedule it about 90 minutes before eating. During high-intense interval training, stress-related hormones can increase insulin resistance, and it may take roughly 90 minutes for this to subside, which is why I time it as such. So post-meal, I usually go for a casual walk just like this. But since it involved a lot of high glycemic index carbohydrates, I might consider walking for 30 to 60 minutes. So usually I'll start walking after around like 15 to 30 minutes after the meal, and I'll walk for like 30 to 60 minutes. But again, as I said, if it's a low to medium glycemic index, then I'll just keep it like 20 to 30 minutes of a light casual walk. So when you compare pre-meal exercise with post-meal exercise, studies show that post-meal exercise is more effective when it comes to decreasing the glucose spike. But remember, exercising at any time can improve insulin sensitivity. I can do more of a moderate or vigorous intense exercise before the meal, thereby I take advantage of it and improve my insulin sensitivity, and thereby able to blunt the glucose spike a little bit, and post-meal and then I go for a walk in order to effectively blunt the glucose spike. But remember, you don't have to follow my strategy. If you feel like this is too much, you can pretty much do a post-meal walk just like this, but make sure that you're doing for like 30 to 60 minutes if you're indulging in a high glycemic index carbohydrates. I hope this video is helpful. If you have any questions or concerns, please post in the comment box below. I'm going to ask you a small favor. If you really enjoyed this video, if you found this video helpful, please make sure to hit the like button, and then make sure that you post some appreciative comments in the comment box below. And then if you want to know more about dietary carbohydrates, so this way you can manage your blood glucose effectively, then check out this video here. If you want to understand about dietary fiber and how dietary fiber can play in glucose management, then check out this video here. And I've linked the video about glycemic index in the description box below. And I'll see you in the next video. Until then, goodbye.